It's interesting because, at the time we were like, you heard a lot of people talk about flatten the curve, right? And I guess maybe to some extent people became weary of that. But it is because, they're talking about flattening the curve in early April and in March for New York, but the rest of the country didn't necessarily, or at least a vast majority of the country wasn't experiencing anything like that. But you get the sense that they got weary with the idea of flatten the curve. And the idea, again, about flatten the curve is that you do not want a spike of patients because your hospital only has so much ability to deal with so many patients. There is not a lot of slack in the U.S. healthcare system at all because it's vastly about making profits and having extra capacity in the event that there's a pandemic or some type of emergency. Just simply is not
too much overhead.
Right. Exactly. It's just simply not profitable. And that is one of the problems with having a for-profit system, is that it doesn't make allowances for events such as these, and why you need a healthier and more robust system of public hospitals in this country, where the idea is you get high quality care, but it is not about making a profit. And so we have this problem. The curve is not flattening in many of these places. You're starting to see some places a little bit, but remember, when we talk about hospitalizations, we're still about 2 weeks away from the numbers that we see today. And Monday is traditionally, we have Monday's numbers. Mondays are traditionally lower, but today's, or I should say on November 23rd, it was 179,000 infected, which is a 50% 14-day change. The deaths are now up 62%. It was over 1,000. That was on yesterday. Remember, Mondays also tend to be days where it's underreported. Hospitalized at 85,000, that's up 50%. I would imagine today's numbers, and I don't know if they've come out yet, will be higher, significantly higher. And
as you mentioned, the 14-day lag for deaths, we're going to see a significant death increase 14 days from now, even 10 days from now, from when we were seeing last week those record highs, breaking records in cases, et cetera, over and over again.
When you see the hospitalizations, it's somewhere between 16, or I should say the infections, it's somewhere between 16 and 21 days is generally when you start to see the deaths come in. And it can range between 1.4 and 1.8 in terms of a death rate. And so we're not going to see the peak of this stuff for a couple of weeks. And that is presuming that we will not see a new peak because of Thanksgiving. And then that will roll into Christmas, and who knows? Hopefully, people will have a clearer understanding of what's going on. Like, I wonder if there isn't more travel now because people presume that by Christmas they're not going to be able to travel. But that just exacerbates things too. I mean, I'm watching images of people in airports, crowded airport waiting areas, and it's just, it's going to be a problem. And one of the things that is difficult, like I was about to say, is because of HIPAA rules, and I'm all in favor of HIPAA rules in terms of confidentiality with people and protected people's privacy when they're sick. We don't have cameras strolling through wards in hospitals. We can't do that. We shouldn't do that. But a lot of times, part of the problem with our modern era is that we don't believe things are real unless we see them on video.
Well, we had that New York Times report earlier in the pandemic from New York where that nurse took a hidden camera in, and that was jarring because of exactly what you're saying. We don't see these kinds of images.
We don't see them. And here is a doctor from Minnesota. This was on CNN, discussing how their healthcare system and the upper Midwest has been hit particularly hard. How their healthcare system is on the verge of just simply breaking.
I think for us as healthcare workers, when we see the numbers of the thousands of people in Minnesota that are getting tested positive every day, it's terrifying, because we can find physical space. We can make rooms. We have made rooms. We can get ventilators. We can get equipment, but we can't create doctors. We can't create nurses to take care of patients. We can't create respiratory therapists to manage the ventilators. And when thousands of people are getting sick, that just means there's more risk for a healthcare worker to get sick, for a healthcare worker to be exposed and then be quarantined. And I think we're all just really, really scared of what's to come, because the hospitals are already full.
And understand, I would imagine in places like New York City, you're going to see less cases of the flu than you typically do, because people are washing their hands. They're wearing masks out in public. They're at least, to some extent, mitigating their exposure to the flu virus, because they're also trying to mitigate their exposure to coronavirus. Around the country, in these places where we're seeing the coronavirus surging, there's no reason to believe that they're going to have a diminished amount of flu cases. And this is part of the problem that people didn't seem to be able to wrap their heads around, or I shouldn't say all people. Some people could not seem to wrap their heads around at the beginning of this, which is we have a certain amount of capacity, slack in the system to deal with the annual flu, but we don't have any more slack after that. And so we're going to see these hospitals are overrun with a coronavirus now. It could get worse within weeks, but we will also start to see them having to deal with flu patients. And
potentially combination infections, which is
indeed
a whole new terrain that we're going to be dealing with in the final months of 2020 and into next year. So folks should just be aware of the situation that you could potentially be exposing yourself and others to. And Thanksgiving this year is just going to be different. And I don't know, you want to say it's going to stink a little bit? No, I mean, yeah, I mean, like the conservatives raising hell about this and talking about how leftists hate Thanksgiving, we hate Christmas too, right? I mean, how snowflakey are you that you can't just take 1 year off from your traditional feasts and the way you celebrate just for the public good? I know that's a foreign concept, but like they're clinging to these kinds of traditions as if it's life or death, basically, but it is life or death for some people.
Exactly. And right. It's not just for the public good. It's for the good of, because look,
your grandma, your uncle,
exactly.
Your cousin.
Exactly. All the people.
Well, I also thought the prevalence of people knowing healthcare workers, I thought would have a greater effect, frankly. Like I have I know somebody in North Dakota who's had to pick up 4 night shifts because literally all the nurses are quarantining with COVID. And Burgum, the governor of North Dakota, had to issue this crazy announcement a few weeks ago that really upset a lot of the hospitals, because he said, actually, you know what? Some places are letting COVID positive nurses treat COVID patients. Like that's the state of things. They brought in a whole bunch of military nurses now. But this is all really Sturgis, right? South Dakota, yep. Nome in Sturgis. She's literally doing $1 million in advertising for tourism at this time.
Yeah,
I'm getting the advertisements
saying, I'm not scared of COVID, whatever. Tough lady
psycho.
she is. Yeah.
Nuts.